Morning and good afternoon and good evening, colleagues. And I'd like to, of course, welcome you to today's IASC briefing on data responsibility in humanitarian action. For colleagues that do not know me, my name is Mervat Shelbaya, and I am the head of the Interagency Standing Committee Secretariat. And I'm extremely pleased to be hosting today's discussion. So we have 90 minutes for this webinar, where, as with usual practice, we'll have the opportunity to hear from our distinguished panelists, which I will introduce shortly. And then we will open the floor for questions and answers and, of course, comments. I'd encourage you, please, to use the chat box to place or pose any questions that you might have. And equally as importantly, also to share any comments, because these webinars are really a great opportunity to hear and learn from colleagues, especially colleagues that are at the front line, on the ground. We want to hear from you regarding your experiences on a variety of issues. But of course, for today, we want to hear about, again, practice around data responsibility. What are the opportunities and challenges around that? So for your information, the briefing will be recorded and it will be made available on the IASC website in case you wish to hear it again later on, or if you'd like to share it within your respective organizations or with your network. So on the issue of today, as humanitarian actors and organizations, we rely heavily and increasingly on data and digital technologies. And this is even more so with the onset of the COVID-19 pandemic. And the use of data and digital technologies are central for our ability in the humanitarian community to make informed and critical decisions for the provision of timely and effective humanitarian assistance and protection. However, if this data and the data technology is not managed safely, ethically, and effectively, dealing with increasingly large volumes of data can place already vulnerable people and communities at greater risks. As such, to do no harm as humanitarians, we need to navigate both the technical as well as the ethical issues involved when working with data and data technologies. So against this backdrop, I'm really very pleased that we are joined today by a distinguished panelists who will discuss some of these challenges and opportunities in data responsibility, and will also offer us opportunities to consider further what needs to be done to ensure and enhance the safety and ethical and effectiveness use of data in our work. So I'd first like to, of course, welcome Ms. Adalina Kamal. Adalina is the Executive Director of the AHA Humanitarian Center with ASEAN. She's held this critical role since 2017, where she led AHA Center in facilitating ASEAN's collective response to major disasters, including multiple emergencies in 2018, where the AHA Center played a major coordinating role. Prior to that, Adalina assumed key positions in the ASEAN Secretariat, where she initiated the development of the ASEAN Agreement and work programs on disaster management and emergency response, as well as the establishment of the AHA Center itself. And she played the central role in ASEAN's response to Cyclone Nargis in Myanmar in 2008. Welcome, Adalina, to today's discussion. I'm also extremely pleased to be joined today by Dr. Asha Muhammad. Thank you, Dr. Asha, also for joining us. I see you online. Asha is the Secretary General of the Kenya Red Cross Society. She has over 25 years of experience working with the humanitarian and government institutions. She served in different capacities with the Red Cross and Red Crescent movement, including as Movement Partnership Advisor with ICRC in Geneva, and as head of operations with IFRC in Johannesburg. Prior to that, she served in various capacities in the Ministry of Health and National AIDS Control Council in Kenya. Welcome again, Dr. Asha, to today's briefing. And last, but definitely not least, I'm happy also that we are joined today by Mr. Stuart Campo, who leads the data responsibility team at OCHA's Center for Humanitarian Data, where he oversees efforts to advance the safe, ethical, and effective management of data within OCHA and promotes data responsibility across the system. Stuart also served as the co-chair of the IASC's subgroup on data responsibility, which led the development of the IASC's Operational Guidance on data responsibility, which he will have the opportunity to speak to shortly. Prior to joining OCHA, Stuart worked as researcher on standards and ethics with the Harvard Humanitarian Initiative. And between 2010 and 2017, Stuart worked with UNICEF in various locations on the ground, including Madagascar, South Sudan, and Kenya. So welcome, Stuart, and welcome to all of our panelists. Now, I'd like to first turn to Adelina. If we can kickstart the discussions, Adelina, with a question to you. Again, colleagues, Adelina is the Executive Director of the AHA Center, which is the Humanitarian Center with ASEAN. So Adelina, for decades, humanitarian operations relied heavily on the collection and analysis of data to inform our understanding of humanitarian needs and to shape humanitarian response and action. And the need for data responsibility is at an all-time high. In your view and from your experience, why is data responsibility important, and what are some of the key challenges and opportunities to implementing it on the ground? I hope you could hear me clearly, Adelina, and over to you.
Thank you so much, for inviting me to participate in the briefing and also to share our thoughts and also our experience from the region. Before I answer your question about why data responsibility is important, I would like to dwell on the issue of why data and information is needed for humanitarian action. The way I say it, that is to alleviate the humanitarian sufferings, right? But then the problem comes when data is collected and shared through so many points or layers from one hand to another and get exposed. And then at the end, somehow, it takes time to reach the one that will be able to provide the resources or alleviate the suffering itself. So perhaps then we need to address the question where the problem is. Where is the problem? Is it on the beneficiary because they don't have the awareness because of the lack of data literacy? Or is on the one who actually manage the data, the one who collect the data in between, the one who process the data and then share it with the one who has the money, right? So I think we need to address this question really, because this is the way I say it, fundamental. Are we actually looking at data responsibility or the use of data from the lens of the beneficiary or from the lens of the organization who collect, manage, and process the data? I'm glad that the guidance that the UNIC produced mentioned about people-centered, right, beneficiary-centered, and so on and so forth. But at the end of the day, if the data that is collected, used, and processed cannot help the affected population and the beneficiaries, then there's no use. So that is one. So then the issue about technology here and data. So if the problems are with the middlemen, those in between, then how can we address the data, right, to be processed and managed in such a way that it can mobilize resources to help alleviate the suffering of the beneficiaries, of the affected people, without getting the data exposed too much? So that's one question. Second, from me, I ask you the question right back to you. To me, I use the analogy of data like oil. It's a raw material. So when data is extracted, collected, and processed, then they become knowledge, they become information, right? And there actually is the issue here, where that information goes, where the knowledge is processed. The irony is that data is collected without the one who has the data knowing what data can be used, the potential of the data, in such a way that when it gets back to them, after it is processed, it is at the higher cost. So I think it's very important that all of us know the potential of data, what data can do, right? And how data can be misused or misabused. So that's the second point. Now, let's say the humanitarian actors are like a ship, and we want to build a ship that is strong to sail through a stormy weather, to collect the data and then help the people, right? And we use data protection as our lifeboat. We cannot also build too many lifeboats so that the ship cannot sail. That's also the issue here. What I'm trying to say here is that what is actually the problem that we are going to address here? Is it about getting the money, or is it about saving the life, getting the resources mobilized, or basically having too many layers in between for the data to be processed? So if we use the localization approach and have the data collected in the country, can we actually make sure that the data is not exposed onto too many hands? Because the one collecting the data is in the country, closer to the people, and have the technology or the oil refinery machinery to process the oil or process the data in the country, so they don't get to be exposed and handed over to many hands. Over to you.
Brilliant. Many thanks, Adelina. Again, a really good way to kickstart the discussions, and you've asked some critical questions and a lot of food for thought. The center of which is, again, your emphasis on ultimately the question is, why are we gathering data? Of course, ultimately we're doing it to make sure that we are, as a community, delivering assistance where it's most needed, but it's also being conscientious that as we deliver this assistance and as we gather this data, we need to make sure that people's well-being, their safety, their rights, and their needs are at the center of everything that we do. So I think this is really a good transition to turn to Dr. Asha, especially as we talk about humanitarian principles and what does principled humanitarian action look like in the digital space. So Dr. Asha, if we turn to you, given the increasing role of data and the use of emerging technologies, what does principled humanitarian action look like in the digital space, and how can we operationalize and systemize such an approach in today's operating environment? Over to you, please, Dr. Asha. Thank you.
Thank you very much, Shilpa, and thank you for having me in this very important discussion and as a member of the panel. I think, first of all, I would just like to maybe take it up from previous speaker using the analogy of the oil, and just to quote what some of the colleagues, of course, have also been saying, is that data is the oil for the business sector, and for humanitarians, trust still remains the old oil and the cornerstone of a principled humanitarian action, resting on, of course, on the principles of humanity, independence, and neutrality. And therefore, of course, as we discuss the issue of data, we have to keep this in mind, while, of course, looking at the need and demand for data in the sectors is increasing exponentially. So I think in this discussion as well, it's a little bit of a catch of 20, it's between a hard rock and a hard place in that sense, because yes, it's important for our humanitarian work, but at the same time, then what is it that we need to do to ensure that we actually pursue the do no harm approach? And I think when we talk about do no harm, first and foremost is of course to the people that we serve, who are the people that are giving us this data, but at the same time also do no harm for the organizations that are actually involved. And I think for us as an organization, these are very important angles that we are always looking at. So for me, I think it's just to start by saying it is clear that digital tools and other forms of technology have become very central in the delivery of humanitarian services. So agencies even like the Kenya Red Cross have increased the need to gather, use, and share increasing large volumes of data. And we've seen these trends being accelerated, especially during the response of COVID-19, for which many organizations have scaled up and have adapted their programs to include modes of service delivery that involve less physical contact. So the uptake of many of these technologies and tools has increased the efficiency and effectiveness of service delivery for many of our agencies. And for Kenya Red Cross Society, we have a lot of examples of what we have been able to deploy, including blockchain technology, but also digital identities to support our work, especially in cash and voucher assistance. We have also adapted, for example, the use of drones, both for assessment and also during the COVID-19 pandemic response in 2020 for the issues of sensitization, but aerial disinfection of public spaces as well. Even with the benefits of these technologies and tools that are offered to us, we should not, of course, as humanitarian agencies, also ignore the risks that come with the uptake of these technologies and tools, which I think there's a whole long list of what we need to look at, but maybe just a few of them, just to say that the exposure of sensitive data that could lead to various forms of harm for the affected people and humanitarian staff is really critical. The breaches in data protection, data privacy, and data security, and the potential misuse of data for non-humanitarian purposes by third parties. And of course, as I mentioned before, the loss of trust between affected people and humanitarian organizations. And for us in particular, I think this has been our biggest pillar, that because of the trust communities have in the Red Cross, that is why we are able to do what we do, but also that is why we are able to collect the kind of data that we are able to collect. And therefore, it's very important to ensure that we do not lose this trust, because then it means that we will not be able to serve the most vulnerable people. I think as we talk about also the kind of data that we are looking at, I think it's good to also say that we need to strike a good balance between, of course, the personal data, but also non-personal data, because sometimes a lot of the discussion is only centered around personal data, but it's important that we also put non-personal data in the picture, because it is also not, it's not also something that we need to just look at without taking the same sensitivities around personal data, because the implications as well of some of that data can actually do harm in the end. So I'm glad to note that as humanitarian agencies, we have made considerable progress in promoting data responsibility in our work in recent years. We have developed policies, guidelines, manuals, including handbooks, and today is a good occasion when we are talking about the launch of the operational guidance, which is very important to ensure that there is also some support to those of us who may be involved and responsible for this particular action. Within the Red Cross movement in particular, just to mention as well that in 2019, December, we had our 33rd International Conference, which is attended by all the Red Cross movement partners, including 192 national Red Cross and Red Crescent societies globally, plus states. And in this conference, we were able to adopt a resolution which was on restoring family links while respecting privacy, including as it relates to personal data protection, as well as a code of conduct on data protection. The International Committee of the Red Cross has also developed a handbook on data protection that was launched last year. And in the same spirit, I think we are here today to also launch the operational guidance on data responsibility in humanitarian action. However, I think the gaps still remain between the frameworks for data responsibility and their practical application in the delivery of assistance. So there are different standards for data responsibility as applied in different organizations and contexts. And this could be as a result of different reasons. One could be the various levels of familiarity with existing data responsibility guidance, but also the related capacity gaps among program staff. And I think this is one issue that we probably also need to focus on in terms of ensuring that those that have to do this work also have the capacity to be able actually to minimize this risk. And of course, the evolving data risks which are related to the new delivery mechanisms. So as Kenya Red Cross, we are of course guided and committed to do no harm, which requires that we prevent and mitigate any negative impact of our actions on the affected population. In order to enhance accountability in the collection, use, and management of this data, we have also ensured that we have developed, with support from the ICRC, a comprehensive data protection policy for the Kenya Red Cross Society. This policy guides the way the National Society will be accountable to the communities we serve. It also defines the internal operational structures that we will use to enhance accountability to donors and to the national government. We're also on the road to mainstream data protection throughout the levels of the National Society. We have started the continuous process, like I said, of building the capacity of our staff and volunteers on data protection, because we feel this is key. They are the ones on the ground. They're the ones interacting with the communities. They're the ones collecting the data. And it's very important that right from the start of actual data collection, they all are aware of what they need to do to be able to actually minimize this risk. So at the heart of our work, of course, is the communities that we serve. And our panelist, Adelina, before actually mentioned the question of, the people that we are collecting data from, do they also understand why we are collecting this data and how we are going to use this data? So the rights of the people need to, of course, be upheld, and any processing of personal data within our national society is done in a manner that is transparent for the people involved and upholds their rights to have their personal data protected. And these rights include that they are given an opportunity to give informed consent before they share their data with us. We also strive to ensure that all the personal data we collect, use, and manage is as accurate and up-to-date as possible. And we work together with the communities to take every reasonable step to ensure that inaccurate personal data is also deleted or corrected without undue delay. At the moment, we are also working to maintain data minimization by limiting personal data processing to the minimum amount and extent necessary, as well as ensuring that all personal data is deleted when it's no longer necessary. And I think this is a bit of probably the dilemma here, because I think on one hand, we of course are encouraging and advocating the use of data to be able to have an effective response. But on the other hand, again, it's a question of how much is enough for that response actually to be done in that manner. At the same time, can we try to minimize as much as possible so that we are also not collecting a lot of data which maybe is not necessary, but also data which, if falling into the wrong hands and places, then can become a problem. But a critical component, I think, in this whole discussion is also the question of coordination and collaboration. And I think this is important, especially for all the humanitarian agencies. There are a lot of initiatives in trying to have some common platforms which can then be used across the sector. But also, I think we know that many countries and governments are also now very keen on the question of data protection. In Kenya, we recently also had an appointment of a data commissioner, and there was also the data protection law that was passed. So as an organization, of course, we need to work within all this at the same time still try to uphold the concept of do no harm. So I think for me, I would probably just stop here for the time being, but to say I think it's important that even as we look at the successes and the good positive points that come from the whole use of data in our humanitarian response, is also just to ensure that there are adequate systems to be able to ensure that we actually reduce the risk of doing harm to the people we intend to serve, but also to the organizations that are also involved. Otherwise, then, of course, we know that our missions will be impossible. So thank you very much, Shaba.
Brilliant. Many thanks, Dr. Asha. Quite rich, and thank you also for taking us through the journey of also providing very practical examples of how digital tools have really improved and enhanced and strengthened response on the ground. And again, talking about examples with drones being used for assessments, aerial disinfections of public spaces, especially in light of the COVID response. But also you talked about the risks associated with the use of data, and including with risks of data being used for non-humanitarian purposes, and how this can affect, again, the breach of trust with the communities that we are there to serve. You also highlighted some of the gaps in the system, whether it's around frameworks and how we translate frameworks and policies to practice. And you highlighted the point around capacities and whether indeed we have sufficient capacities on the ground to be able to translate policies to action. And you highlighted the issue around coordination and collaboration across the system. So maybe that also in itself is a good transition to turn to Stuart, because this is precisely the work that Stuart and colleagues from the Interagency Standing Committee organizations have been working on over the course of the past several months. And it's thanks to Stuart from OCHA, as well as UNHCR and IOM, that have headed a subgroup on data responsibilities, precisely to work on the production of the system-wide guidance on data responsibility. So I'm really very happy that Stuart will be able to speak to this and speak to why this guidance that has just recently been launched and endorsed, why is it important, and what are the tools that are available to ensure this coherence and the coordination of efforts around data responsibility, and what impact do you foresee in rolling out this guidance and these tools? So over to you, please, Stuart.
Thank you so much, Miravat. It's really exciting to be here and to see so many people dialed into this discussion. I'm also grateful to my fellow panelists, Dr. Asha and Adelina, who've set the stage very well in terms of what's at stake. I don't need to give too much background on what led us to initiate the process to develop the operational guidance, because both speakers have exposed in different ways just how critical this is to humanitarian action today. But perhaps to start with the point that Dr. Asha finished on, coordination and collaboration are really at the core of the process that we've been going through together with 20 different organizations over the past year to get to the launch of this operational guidance. As Miravat mentioned, under the Results Group 1 of the IASC, in January of 2020, we initiated this process to look at what guidance was available, what gaps existed, and how we could collectively come together to address the challenges that we faced. This led to a lengthy process that was consultative and, perhaps in the face of the challenges with COVID-19, something that we thought at different times might not be possible, but we persisted and just last month launched the final product. The operational guidance is the first guidance of its kind for the humanitarian sector. What it brings together is many of the different resources that the two previous speakers mentioned, but also some new takes on how we can collectively and institutionally address challenges in how we manage data. Maybe just to recap again what we're talking about when we talk about data responsibility, this is not just about the risks and potential harms, but really, to borrow Adelina's phrase, about the potential of data as well. What we want to be helping colleagues in different response environments do is think about and balance the risks and benefits that we can reasonably expect data to bring to us, and then navigate those effectively. I also like the ship metaphor. I'm resisting the urge to merge that with the oil metaphor because we don't want to see the humanitarian system as an oil tanker navigating rough waters. But I think that in many ways, the ship metaphor is apt for what the operational guidance offers. There are two core components to the guidance that I think the audience should be familiar with. The first is a set of principles for data responsibility and humanitarian action. And the second is a set of actions that are articulated at 3 different levels within a humanitarian response environment. The principles could be seen in many ways as a compass or a navigation aid. What they offer is a distillation of over 55 sets of principles and guidance documents that already existed that we as a group went through and analyzed to determine which principles were most critical to data in the sector. So in that set of principles, you'll find different considerations that, again, have already been touched on by the previous speakers, including people-centeredness, a commitment to transparency and accountability, coordination and collaboration, and a number of other key principles for how we manage data in the sector. What we hope with this set of principles is that it helps us navigate both collectively and at the organizational level the different challenges and opportunities that arise with data and humanitarian action. We also recognize that not everything is codified. And so even with this new framework for the sector, there will be questions that we haven't been able to anticipate. This is the nature of the beast when we're talking about digital tools and data techniques that evolve faster than the instruments that govern their use. And so again, these principles really should serve as a navigational aid to help us deliberate and balance consequences when faced with different challenges. The actions are maybe the sort of different steps you can take to make sure that the ship stays its course. And what they are practically are things that you can be seeing at the system-wide level, the cluster or sector level, and then the organization level in a given response to help design safe, ethical, and effective data activities and deliver those with the optimal impact for the populations that we serve. Here are a couple of examples of those actions. One that we see as perhaps the most critical at the system-wide level is the establishment of an information sharing protocol for the response as a whole. What we've seen over the past few years is a tendency to focus on bilateral data sharing and data sharing agreements or other similar interventions. And while these types of activities are critical, what often is the result of this is that you have a lot of close institution to institution data sharing, but perhaps a lot of redundancy or duplicative effort. What we want to enable is, again, optimal use of the data to enable the best response possible. And so information sharing protocols at the level of a sort of system-wide instrument like the inter-area cluster coordination mechanism or the information management working group can really help do this. And we've seen in a number of response environments, including complex environments like Syria and Yemen, that establishing these types of protocols can really help ease decision-making and improve safe data sharing for response activities. Another example, which probably is the most critical gap, if I can speak sort of candidly, at least based on our experience, is the data impact assessment action. That's how it's framed in the operational guidance. Some people might refer to it as data protection impact assessment or risks, harms, and benefits assessment. But the point of this action and why we thought it was critical to include it in the operational guidance is that we need to enable colleagues to assess and balance the potential benefits and risks of data activities. This is critical, and it's not something that's happened enough in the sector so far. So the actions and recommended approaches to implementing those actions are part of this problem, but also for leaders who might be listening or part of these conversations, it's about creating space for this to happen and ensuring that your teams have the necessary expertise on the ground to really do this in a meaningful way, understand what is at stake, and then make informed decisions to ensure principled action with data in humanitarian response. Maybe one last word on what's in the operational guidance, and then Merva, I'll hand back over to you. We included an annex of templates and tools that really exist as a more living resource They are not final or mandated by any sense, but really they're meant to serve as evolving documents based on experience of organizations across the system in implementing data responsibility. So when you see the document, which I believe was already shared in the chat and is linked on the website for this event, you'll see that there are a number of templates that already are linked to the different actions for data responsibility. These will continue to evolve. And this is an area where we would particularly love to hear from different colleagues who are actually facing these challenges on a daily basis so that we can ensure that we continue to evolve this operational guidance in the future. Maybe just to say on that point, we do plan to continue the collaboration that began with our subgroup under Results Group 1 in the form of a data responsibility working group that, along with UNHCR, IOM, and DRC, our team at the OCHA Center for Humanitarian Data will convene in the near future to continue this conversation. So colleagues who are interested in being part of that collaborative network can feel free to reach out, and we really look forward to continuing to tackle this complex issue together. Thanks, Mirvat.
Great. Many thanks, Stuart. Really helpful. And thanks also for shedding light on the fact that this guidance is the first of its kind, and also sharing some examples of the specific, again, principles and actions that can be put into practice, including with sharing information protocols for the system as a whole to augment and complement, of course, the bilateral agreements that are happening on the ground, which can help and facilitate decision-making and improving the response. So colleagues, I really want to invite you once again, please do use the chat box if you have any questions or comments to the panelists. And I can see one of the comments coming in from Rita, specifically to Dr. Asha, but also for the panelists, noting the growing concerns on the ways in which data is collected, which at times brings back the traumatic feeling on the side of persons of concerns. And also Shafiq came in with some comments, specific comments with regards to how we are gathering data specifically in the context of the COVID. We're going to roll out COVID vaccines in the northeast of Nigeria, currently facing huge security challenges. If I may ask colleagues, if you're not speaking, if you can just place your phone or your computers on mute so that we minimize the background noise. But again, speaking to the experience in Nigeria, currently facing huge security challenges for the humanitarian workers to access communities in those hard to reach locations. Also a big challenge to find out the populations trapped in the conflict zone where health situation, we see a lot of challenges in the upcoming COVID vaccination. So accurate and complete data is very important in a humanitarian context with lots of uncertainties. So thanks again, Shafiq, for sharing your experiences from Nigeria as well. Perhaps just a few more follow-up questions from my end to the panelists, starting with maybe Dr. Asha on data responsibility challenges and opportunities with that the Kenyan Red Cross Society may have encountered in using blockchain and drones in the response. Would you be able, Dr. Asha, to perhaps share some insights as to the opportunities and challenges that lie with using blockchain and drones from your perspective? And then I would love to also hear a little bit more from Adelina, your views, especially also having led and played a critical role with the response in the ASEAN countries. What does people-centered data responsibility look like practically on the ground? So I'd love to hear your thoughts, Adelina, if it's possible to share some examples on that. And then finally, we'll turn to Stuart, if you can share also your perspective in terms of what can be done to increase the capacity of humanitarian workers on data responsibility. So of course, this webinar is one of these opportunities to raise awareness about the fact that data responsibility is everyone's responsibility, and of course the guidance being available, but what more can be done to make sure that we enhance the capacity of humanitarian workers in this particular effort. So maybe if I can turn first to Dr. Asha, and then we'll turn to Adelina, and then Stuart, please, with responses to these questions. Over to you, please, Dr. Asha.
So thank you very much, Shelba. Maybe first of all, just to acknowledge the comment by Rita that yes, of course, sometimes maybe even the process of collecting the data itself could leave some traumatic experience for the people. And I think that's why we're saying it's very important that even for those that do the collection, there is some capacity that is built to ensure that we can all be very sensitive about that process, because especially considering that, you know, we are collecting data from people who are already affected by, you know, the emergency that they are experiencing, or by whatever situation they find themselves. So that sensitivity, and also in which form you're actually collecting this data. And I think one of the challenges I find actually personally is that some of the discussions that we have with communities when we are also collecting data doesn't provide a very confidential environment. And I think this is probably what I see as a challenge, where sometimes people are left a little bit traumatized, because when you're asking for some of this information in a very open manner and in maybe a very open space, then of course this is important. So I think it just calls on us as well to be a little bit sensitive about how we actually approach the people that are affected. So to the question on the experience of the Kenya Red Cross Society, I think the opportunities are huge. And I think clearly, like we mentioned before, is that there is no way of going back. So I think it's clear that even improving our humanitarian response will require that we actually embrace technology and we digitalize as much as we can. So definitely we've seen the difference it has also made in terms of the, you can say, the quick response, because for example, when you're using drones to do assessments, as opposed to having people drive all the way and try to work in these communities to actually even get to assess, you know, the damage or the impact that has happened. So of course it gives us a very quick response, which means therefore that we can address and respond to the issues or to the affected people in a timely manner. So I think this is very critical and important. But also the benefits of cost, it's a huge investment in the beginning, and that is probably the other gap I can mention, to say that we would normally say that, of course, that is a bit of a deterrent, and as humanitarian organizations, when we want to get into this space, then do the partners and the donors actually accept that there is a huge investment in the beginning, but it will pay off later. And so it requires some resources, and that sometimes can become a bit of the challenge, because I remember when we were even starting the question of drones, there were a lot of questions from many partners in terms of, you know, why do you want to do this, and is it really going to be useful? But I think we have seen that it is important and very useful, and other organizations, even including government, are also now using taking cognizant of some of these aspects. But also, if I take again the COVID-19 situation, is that it also helps us to minimize the risk of infection for the humanitarian workers themselves, the frontline workers, but also vice versa, because you know, we can also be the source of infection for communities. And so using some of this technology. So those have been very positive points in that direction. Maybe on the other side, in terms of some of the challenges, first of all, when you're introducing some new mechanisms or new methodologies, new technologies in the community, there is always a challenge in the beginning when you have to actually start to introduce this. And you have to be able then, of course, to sensitize the community in whichever form you can. And I think I see somebody also just asking, how do you ensure there's informed consent when collecting data via drones? And I think this is the other aspect. I think for us as the Red Cross, the advantage we also have is that we work through a network of volunteers that are present in all these communities. And therefore, even before you deploy some of this, you already have some people within those communities that are our foot soldiers that can actually do some of that background work. So introducing the technologies, introducing some of this new ways of doing things in communities, of course, becomes a bit of an uphill task. And there's also the challenge of trying to ensure that communities can still trust that when you're not speaking to them on one-on-one and you're using some of this technology, that they can still trust that the information you collect will still be safe with you, and you will be able then to keep that confidentiality and use that data for actually the correct purpose. Then, of course, the last one that I keep coming back to is on the issue of capacity. You know, you want to introduce new technologies, you want to go into digitalization, but what is the capacity in the organization to be able to do this? We know, like for drones, we have to train some of our colleagues also to be the pilots, to be able to manage this in the proper way it's done. And of course, it's important to be able to build that capacity at the same time. So yeah, briefly, I can maybe share those as some of the opportunities and still, of course, some of the challenges that we have experienced. Thank you, Shabai.
Thanks a lot, Asha. Really appreciated, and I know it is quite a complex issue and quite a hard question also coming in terms of receiving consent from vulnerable communities, especially when we're using drones. And I guess ultimately it's also what are the drones used for. And I'm certain that while we're using new technologies, it's also a learning process. And as you pointed out, Asha, a big part of it is building the capacity of our humanitarian workforce on the ground, making sure that we're working very closely with communities to make sure that decisions or avenues that we are capitalizing on to be able to reach the most vulnerable is indeed done in a smart, efficient, and intelligent way, and does not breach the trust that we have or that we've built with communities over the years. So maybe with that, I'd like to turn to Adelina, and if it's possible, Adelina, again, speaking to your experiences around what does people-centered data responsibility look like from your previous experiences, and if there's an opportunity to also, speak to the question posed by Luke in the chat around your thoughts on the use of satellite imagery to generate insights for humanitarian purposes. And again, I'll pose this question also to Stuart, but if there are any initial thoughts, Adelina, that you can share on that, that would be greatly appreciated. So over to you, please, Adelina.
Thank you very much, Marifat, for the question, and Luke for the question. I'll try my best answering the question how to ensure people-centered or beneficiary-centered data responsibility. But based on my experience working in the 7-11 region supermarket of disaster, I have seen enough that people come to a country collecting data, right, asking questions to the same household, to the same beneficiary, asking the same questions. And then at the end of the day, their needs are not fulfilled. And they get not what they need, but what we have, right? What we have in our warehouse or stockpiles. And this is criticism to everyone in the humanitarian sector. So I think we really, before we actually address the issue about data responsibility, I think we also need to address the issue about data collection, about why we are collecting data in the first place. So if the intention of collecting data, managing data, and processing data in a responsible manner is to help the people, but then at the end of the day, they don't get the help that they need. So what's the use of collecting data and data responsibility in the first place? So that is one. So perhaps then our business model needs to change. And then it comes to the second issue about technology and innovation. To me, I've seen too many times that people with good intention coming to our region, to our countries, offering products, right? And somehow, like what Dr. Asha mentioned, the products or the technologies are offered in such a way that the people are coming back to the technologies and the product because only the provider can do the data maintenance. And that is what I call economic rent. And that actually is more of creating reliance rather than resilience. So rather, the way I said, it's not the technology that is the problem. It's actually the processes and the innovation. So perhaps when we talk about data collection, data responsibility, not only using technology is not bad in terms of the product, but also look at the processes. How can we make sure, for example, the question, how can we make sure that, again, going back to the first question, to the first comment that I made, Merfat, can the technology or innovation help us to make sure that important data, sensitive data, personal data do not get exposed to too many people and too many hands and misused? In the WhatsApp, we have the end-to-end encryption, right? And there are layers in between. They get cut. And that is actually the purpose of technology. That is to cut the layers, to cut the intermediaries. I know that many people may lose their job, but if at the end of the day, we can address the needs of the people and they get, they get the chance to decide what they need rather than us providing what we have, then why? Then we actually relook at our business models. Now, about the use of technology, talking about the use of technology in the humanitarian sector is like talking about us riding horses while others, like the private sector, are already riding Tesla cars, electric Tesla cars, right? We are left behind 100 steps from the private sector. And I think we need to ask this question. Why are we left behind? Is it because we are too focused on building the lifeboats instead of the ship, the big ship, to save the life? So then another Tesla car actually riding right through the waters, and it's not a Tesla car, but Tesla ships. So perhaps again our business model should be changed. Otherwise, then we will keep riding the horse. If the Amazon that has trillions in terms of market value, they can digitize everything, and they can go big, right? And use data basically to sell products. So then perhaps we can ask the Amazon and the private sector, but also being very careful, right? When we work with the private sector, how can actually they use data to address a protection, protection of the customers? So if they can actually do that in their $1 trillion industry, how much are we? $200 billion in the humanitarian sector. So perhaps then we need to turn to them for inspiration. Just a question. Thank you.
Thank you, Adelina. And again, it goes back to the central question that you shared in the very beginning, which is, what is the purpose of gathering this data? How can we minimize the movement of data between middlemen, as you referred to it, earlier in your interventions, so that we minimize the risks on communities? And thank you also for shedding, of course, light on the importance of partnership also with larger stakeholders or broader groups of stakeholders, including the private sector, while also being conscientious of some of the risks associated with that as well. Many thanks again, Adelina. And with that, I'd like to turn to Stuart. And there are definitely a number of questions in the chat box that I'd like to ask or direct to you, Stuart. So in addition to speaking to what more needs to be done to enhance the capacity of humanitarian workers on the ground when it comes to data responsibility, a point that also Asha highlighted as critical, would be great to get your views as well, Stuart, on your thoughts on the use of satellite imagery to generate insights for humanitarian purposes. This was a question by Luke, but also a question from Bernadette around providing guidance on data sharing with the military. And she spoke to, of course, her experience in Lebanon. So any insights on that, Stuart, would be greatly appreciated. Over to you, please, Stuart.
Thank you, Mervat. And I will do my best to answer some challenging questions. In terms of the capacity question, both Asha and Adelina spoke already to this, but I think in terms of how we've been thinking about it at the Center for Humanitarian Data, but also how we thought as a group about this particular issue while we were developing the operational guidance, there are two key points. One is to recognize that a lot of what is required to manage data safely, ethically, and effectively exists already in our processes, in our different strategies for delivering assistance, in our existing approaches to collecting and managing data. So we hope that this does not sound all new and different. When people see the operational guidance and when people hear a discussion about data responsibility, this should not feel like yet another entirely new discussion, right? We really do hope, and I think with the approach that we took to develop the operational guidance, we saw that much of this practice already exists. And so it's both a kind of cautionary reminder, but also hopefully a motivation for colleagues that are looking to do more around data responsibility. Much of what we're calling for already is in place. So hopefully in many response environments, this will not all look additional, but rather building on sort of fundamental interventions. I think particularly from the protection space within the sector, we've drawn quite heavily on existing practice, and there are a number of clusters or sectors that have been leading forward on these issues for many years. So in terms of the capacity gap, it's important to recognize that existing capacity as well. Related to this is that there's a need for additional capacity development or training and other forms of support to build data literacy, both on the, what I like to think of as the what of data and digital technology, but also the how. So in some cases, and Dr. Asha mentioned a great example, teaching a staff member to fly a drone, that's kind of the what. What is this additional intervention and how do we deliver it effectively? The how of using data and digital technology in humanitarian response is really more at that process level and that strategic level. So looking at where do these tools fit in to our existing processes? How can a protection assessment also cover data-related issues? So part of it's that translational piece, figuring out how data and technology inform and hopefully help accelerate the positive existing strategies that we have for delivering assistance while not exacerbating some of the existing risks or challenges. And that's certainly not something we can take for granted, but hopefully that distinction is helpful because we don't want to only invest in the shiny objects, the what's, right? The new technologies, the new data science methods. We also want to invest in how those are incorporated into the delivery of assistance. That's certainly been made more difficult with COVID-19 and with the restrictions in access that we have, both at a kind of meta level between headquarters and different response locations, but also within a given response, the limited mobility that colleagues have to move from the capital to different field locations. But there are some strategies that we and other organizations are exploring to deliver content in smaller and more digestible bites. I'm constantly reminded by our lead of the center that people write more than they read in the sector, and that's certainly true. So while this operational guidance, as operational guidance goes, is quite short, it's still 37 pages long, and we recognize that. So we will continue to think about strategies to help colleagues access the content that they need in this guidance and translate that into their existing practices. So hopefully that speaks to both how we can tackle the capacity gaps, but also how this builds on existing capacities. To the question about satellite imagery, I think Asha addressed it, at least in part, very well. Maybe just to say that this is a good example of a long existing, but for humanitarians, still somewhat emerging type of technology and data intervention that we're figuring out how to balance, essentially. There's greater and greater potential as the technology advances in terms of the granularity of the imagery that can actually be gathered, and therefore the potential analysis and insight that can be derived, which means that it has potentially much more value to informing humanitarian response. At the same time, that means that the data protection and broader data responsibility issues are more complex. And so it's a good example of the type of intervention that requires deliberation, that requires this compass of principles, as well as some of the processes that we've outlined as actions in the operational guidance to help people think how to do this effectively, ethically, and safely. Maybe it's also just worth mentioning that some of the most widely referenced guidance came out of a program at Harvard University, the Signal program, that itself was started around satellite imagery analysis for human rights programming and humanitarian response. And the colleagues at Signal at the time realized in doing their own analysis the great risks and potential harms that come with satellite imagery in these contexts. That led them to develop the so-called Signal Code, which is a rights-based approach to information in crisis. And it's a great resource for this particular type of intervention, since it was almost a reaction to the recognition that we don't know enough about the potential harm to mitigate all that harm. Maybe just finally on the question about sharing data with the military and the example from Lebanon, let me speak slightly more broadly, recognizing this is a complex question. Of course, there are existing practices and strategies from civil-military cooperation to learn from, and I am not an expert in that area, but I would say that as much as possible, that existing corpus of guidance and practice should inform how we think about those issues. From a more operational humanitarian perspective, this would fall under how we've been thinking about sharing data with various third parties. Third parties being not purely traditional humanitarian actors, in this case, the military, but you could imagine a number of other counterparts like that as well. And the important thing is to make sure that the principles that inform humanitarian action drive management of data, including with these counterparts. And so, to put it bluntly, making sure that any third parties play by our rules as a sector, uphold the principles that Dr. Asha mentioned, and the broader set of principles that we've outlined in the operational guidance, should inform how requests for data and the sharing of data with different counterparts are handled. And so hopefully, again, this collective approach to establishing those principles and then realizing them in practice will make these discussions easier over time, because it will be more common practice and these counterparts will understand more about what we're trying to do from a principled approach to humanitarian data management.
Great. Many, many thanks, Stuart. And this is a good way of concluding also your points there, which is at the heart of all of this is, again, the humanitarian principles and making sure that we capitalize on, utilize humanitarian principles to guide all of our work, including also how we gather information, how we share information, including our engagement with various stakeholders and partners. So I'd like maybe just to highlight also a comment from Jaber, who is in Sudan, and he speaks to his experiences in responding to in Ethiopia, talking about using technology made a lot of impact, such as satellite images analysis. It helped a lot in mapping the services and camp profile. Regarding the data responsibility and principles, I do see we do have opportunity via dedicated courses and key messages via IM team and all to enhance this aspect and make it part as a key part of our response and support on the ground. So this is, again, great to hear from Jaber on his experiences in the response in Ethiopia, and also highlighting, again, there are quick solutions, whether it's in terms of training, dedicated courses, using technology to make sure that we get the word out around how we can better manage data while also protecting the populations we are there to serve. I'd like to perhaps turn again to you, Dr. Asha. There is a question from Taj, perhaps a difficult question, but I'll hand it to you. Talking about, despite having data sharing protocols and/or policies in place, governments pressure humanitarian organizations to share information and data regarding beneficiaries who are assisted by humanitarian organizations. what can be done? Is any insight in terms of, how best to handle or deal with these types of situations or circumstances from your experience? So over to you, Taj, although I know that it was also addressed to Stuart, but I'll turn to Stuart with another question if that's okay. So over to you, please, Dr. Asha.
Thank you very much, Shabaya. And as you said, of course, a very tricky, difficult, sensitive question. But all the same, these are the realities sometimes that we have to deal with. And I think what is important, I find, is always the discussions and the dialogue before anything happens, to be able to have an understanding and an agreement in terms of what it is you can be able to share and what you cannot share. And that is why in my earlier intervention, I also mentioned about the resolution that the Red Cross movement was able to pass in the conference in 2019, where states were also represented. And this was actually part of that discussion, to say that as we continue with our work, and as we give services, especially in the area of restoring family links, then states have to understand and appreciate that there are certain data that we will not be able to give, and they should be able to understand that for the sake of course, the people that are affected as well. And I think as much as it was, as always, not an easy discussion, but I think we finally all agreed that yes, there are also certain limits to some of this. Today, I can say, for example, for Kenya, when the government also passed the data protection law and appointed a data commissioner, one of the issues, of course, was the engagement with the data commissioner, also to be able to present our work and also discuss the data protection issue in the country, and what kind of data the organization can be able to give or not to give. So I think it's important to have those kind of frameworks to be able to support this work, because it's very difficult to have some of these discussions in the middle of a response or in the middle of an operation, and therefore we need to actually do this in advance and use that as the guide and also as the basis of some of the work going forward. So I think maybe very briefly, that's what I can say, because but for sure it is not always an easy discussion, because there are also sometimes issues which may border also towards maybe the government also for it to respond, then maybe it requires also some of that information. So how do we ensure that everyone can actually be able to give the response that is required, but being very sensitive about what information we can give or not give. So I would just emphasize that we need to be able to push for some of these frameworks and very clear understanding with authorities in terms of what we can do and what we cannot do, and have that dialogue before any emergency happens. Thank you.
Brilliant. Thank you, Dr. Asha. And as you said, a lot of it, again, at the core of this is humanitarian principles and building a relationship of trust, of course, with the vulnerable communities that we're there to serve, but also the content, engagement, and dialogue with the government to make sure that, again, in terms of managing expectations of what's feasible and what's not feasible is clearly laid out prior to also a crisis or disaster unfolding. I want to actually turn now to Adelina. There's a question from Miguel around the engagement with the private sector. And I know, Adelina, you mentioned the importance of capitalizing on, of course, the wealth of knowledge, expertise, and skills in the private sector. But also you cautioned, of course, around they need to be also careful about how we engage with the private sector on the issue of data and data responsibility and data technology. So are there any insights, Adelina, also that you can share in terms of how can we learn or engage more proactively and efficiently with the private sector instead of reinventing the wheel? Question from Miguel. Any thoughts on that, Adelina, would be greatly appreciated. Over to you, please.
Okay, thank you so much for the question. Well,
Adelina, if I may, and also give you like a few seconds to think through the response as well. I'll also turn afterwards to Stuart. There is a question from Andre regarding how the guidance is going to be rolled out to reach different levels. Has this been already discussed and agreed upon? It would be great to get your thoughts on that afterwards, Stuart. Over to you, please, Adelina.
Thank you. Actually, that's not really an easy thing to do, because I think sometimes when we talk about the one that actually is using the data, or the one that we work with, right? That also around the issue of trust. So I think building trust with whoever it is, including with the private sector, is really important. And I like what Stuart said. Perhaps the humanitarian sector need to basically be the one, saying that these are the principles. This is how we're going to do it. And in our case, we cannot trade data. We cannot share, data for commercial use, and so on and so forth. But I think when it comes to private sector, while we are actually quite, strict in terms of our principles, I think we can also work with them. If we already address the issue on trust, on the part of the technology. And technology and innovation is not only the product, but more in terms of the processes. So again, I'm not sure whether this is also a good example, but I used the case of Amazon. If they can actually totally digitize, right, and offer the products online, I'm not sure whether they actually have problems in terms of data privacy and all that. And they're $1 trillion industry. And we're just talking about Amazon, not yet Facebook, Google, and the big private companies. Why don't we learn from them on the business models and how they basically use technology to ensure data privacy, to ensure that we can cut layers, to ensure that we can get the users or the beneficiaries in our case to get the chance to determine what they need and not what we have. So that's how I think we need to understand first what we want from the private sector, right? And not just to get everything from them, but what we want. And I think they can actually offer that. I have talked to many private sector from our region, and what they said to us, identify what the problems are, because the technology will be there to help you, and identify the state where we want to be, and we will help you. So if you don't understand the problems and how to get there, and how to, for example, cut layers, the middlemen, so that we don't expose data to too many hands, and how are we going to use technology, including business models and processes, to help solve the problems. So understand what we want first, and be strong in terms of our principles.
Great. Many thanks again, Adelina, to this response. And I'm conscious we have 15 minutes and there is quite a few questions that are coming into the chat box. So turning to Stuart, 2 questions, actually, if you can hear your responses, Stuart, around, again, the guidance and how we'll be able to roll it out at the different levels. But also there's another question from Alex on what can be done and what's the role of the intercluster IAM working group in each operation to promote data responsibility. So your thoughts on that, Stuart, would be greatly appreciated. Back to you again, please.
Great, thank you, Mirvat. And maybe I can even speak also to Grace's question about the interagency mechanisms that can support the implementation of data responsibility as well. Try to cover as many as possible. So the short answer in terms of how we're rolling this out is that we're working through existing mechanisms primarily, both as individual organizations and as this network of partners that worked through the subgroup to develop the operational guidance. This is primarily through briefings to start, at least, as well as more direct support to country level counterparts. So we've already conducted a few global briefings, and this briefing I think is a great opportunity to spread more widely the net where we're trying to capture different points of contact. And again, we would welcome colleagues reaching out to discuss in more detail how we can advise on implementation in different environments. Looking through at the global and country level, how both the clusters and sectors, as well as the information management working groups can support the cluster sector level actions is critical, and that's one part of the puzzle. However, we're also looking at that interagency coordination level in different responses. So more specifically to the intersector coordination groups or the intercluster coordination mechanisms or groups, how those really play a central role in those system level actions. Hopefully in the operational guidance itself, it's quite clear what the roles and responsibilities are at those two levels. If there are questions, of course, again, our team at the Center for Humanitarian Data through OCHA offices in different locations will be happy to advise and support on basically where to get started and how to proceed in terms of prioritizing actions for data responsibility. This is also a critical piece for humanitarian leadership, and it's worth noting that the new guidance on humanitarian leadership explicitly calls out data responsibility as a topic for humanitarian coordinators to be tracking. So we do hope that over time, at all different levels of a humanitarian response, this can be more effectively supported. The last level in the operational guidance, and maybe the most critical level to speak to in terms of supporting rollout, is the organization level itself. Now, this is where our individual members, but really everyone across the humanitarian system has a role to play, but also where you could argue the most has already been done. So many organizations, as I think is particularly evidenced by what Dr. Asha has explained around how the Kenya Red Cross is addressing these issues, many organizations are already on top of tackling the different challenges and opportunities with data responsibility. And so we hope that those organization level actions are building on existing practice and expertise, and if anything, really helping to clarify how that organizational level connects to the cluster sector and system-wide level. But very much building on what exists, going through existing channels. As I mentioned earlier, we are establishing a global data responsibility working group to help kind of track and monitor what's working well and what could be improved. And also critically, as we've committed in the operational guidance itself, monitor where we can revise the guidance on this 2-year cycle, which is what we've committed to in the document. Maybe just briefly on the specific mechanisms, there are recommendations for those mechanisms in the document. And again, we've had a number of discussions with country level IMWGs and ICCGs or ICCMs already, where we're learning what this can look like in practice. And I think that's how we'll continue focusing our energy, is really just supporting those colleagues to come together and collectively look at what the most pressing needs are in terms of data responsibility in their context, and then how different players can support them in addressing those.
Thank you. Thanks a lot, Stuart. This is really, really very helpful. And I want to actually give the opportunity for the panelists to come in with some final thoughts, any final responses to the questions that have come in, any final asks of, again, we have over 100 participants now, 100 participants still online with us. So any asks of colleagues that are online as we conclude this session would be greatly appreciated. Again, this was a really, really very rich discussion, and it's great again to have a different perspective, whether it's from Adelina and her experience in ASEAN, and whether it's Dr. Asha with her experience with, of course, the Kenya Red Cross Society, and of course, the important work that Stuart and colleagues in the IASC are doing around to ensure coherence and a coordinated approach to data responsibility was really, really valuable, I hope, for the participants online. I have a few closing thoughts, but I'd love first to start with Adelina. Any final thoughts as we conclude this webinar would be really, really appreciated. So perhaps hearing first from Adelina and then Dr. Asha and then Stuart. Over to you, please, Adelina.
Thank you very much. Well, thanks again for the opportunity. I think it is really timely for us to learn from other regions, as well as the UN, the UN Interagency Standing Committee, and the other humanitarian partners on data responsibility. Why? Because in ASEAN, through the AHA Center, we just set up a network called the AHA Center Information Management Network. And it's a network of the National Disaster Management Organization from the 10 ASEAN countries, plus members of the ASEAN Emergency Response and Assessment Team. And these are people who are on the ground. They're boots on the ground, those who are operationally in charge of collecting, managing, and regulating disaster data. And they have been sharing common data challenges in terms of data sharing, management, standards, interoperability. And now they are banding themselves together with us at the AHA Center. So perhaps in the future, Merfat, we can also share our experience, because this is like, also something new for us, and we'll use the guidance also to enrich our discussion, because this is coming from the global conversation on data responsibility, and we can see how we can contextualize the guidance to our context, and then perhaps we can skip the painful experience that other regions have experienced. We don't have to go through that, right? So that's one. Thank you so much. And second, perhaps I think this when we talk about data and then technology, the way I say it, data is much more powerful than technology, and I think not so many people realize the power of data. But I think it's also very important that we build awareness on the potential of data and what data can do in the affected countries, in the countries that are prone to disasters. And perhaps we can build the technology, because we do have private sector. We do have the unicorns, right, inside the ASEAN region. We have the private sector. We have people who may be able to share technology inside the countries, become the oil refineries, become the data processor, so that the data do not get shared to too many hands. And I believe most of the countries that in ASEAN region, for example, can harness this the use of big data, artificial intelligence, predictive analytics, so that the data will actually go back to the population, and then the population get what actually they need. So it's really about localization. It's about utilizing what actually inside the country in terms of the technology, and making the country more reliant on themselves, and make the region more self-sufficient. Thank you.
Thank you, Adelina. And again, of course, we welcome any opportunity to hear from ASEAN and from the AHA Center, perhaps in a few months, because again, this was an excellent, of course, opportunity to learn from you, but also I know that this is a relatively also new sphere or area that the AHA Center is getting more and more involved in. So we'd love to hear your experiences even more in the next few months. So thanks so much again, Adelina, for making the time. I know it's absolutely late in Jakarta, so it really means a lot that you're able to join us and share your experiences. So perhaps with that, just turning to you, Dr. Asha, and thank you also for making the time, but over to you, please, with any final thoughts.
Yeah. No, thank you very much, Shaba. I think for me, just some very quick points to conclude. One is just to say that it's important to put in place a robust community engagement and accountability approach where targeted individuals are aware why we are collecting their data. But more importantly, I think, as Adelina said, is what does it mean in terms of the humanitarian support that they receive, so that they can understand that actually this data is important and it will actually lead to a more efficient response in their favor. Secondly, I think it's the question of still trying to balance between, yes, data is important, but how much data do we really need? So just collecting enough for what we really need and for the work that we want to do, so that we do not just collect data and end up with a lot of data which we are not using for that sake. I think the question of technology is again something we really need to look into. It is important, and we know this is the way forward. But how do we also ensure that some of the technology we are using is not also at the risk of data fraud or being tampered with? Because I think today we also live in an environment where sometimes some of these issues can happen. So how do we ensure that this technology is also not one that can be easily abused, and the data can actually be lost in different ways? And then finally, it's just about, I think Sadelina also who mentioned, is just the fact that how do we ensure that digital solutions are, interoperable, so that we, as humanitarian organizations, we are having similar solutions, and persons that are affected do not need to continuously keep registering themselves and having the same data being collected over and over by the same, by different organizations. And sometimes it happens even for the same disaster. You have 3 different 4 organizations coming into a location, and each one is coming in and trying to collect data of the same affected population. So I think those for me will be the closing remarks. And to, again, thank you very much for having me in this panel. I think it's been interesting as well, and a lot of learnings for us as too.
Huge thanks, Dr. Asha, and I can completely relate to, again, the critical point also that you've mentioned around preserving and maintaining the dignity of vulnerable communities as we interact with them. And also, as you've mentioned, a number of organizations visiting the same families or the same communities and asking them similar questions. There has to be, we can do better. We can do better as a system and as a community to make sure that as we gather data, in addition to the protection aspect, that we also do it with dignity and minimize, again, organizations asking similar questions to the same, communities that we're serving. So we can do, definitely, we've done a lot and there's a lot of progress, but we can definitely do a lot more. Maybe Stuart, your final thoughts and comments from your end?
Sure. Thanks, Mirva, and thanks again to Adelina and Asha for your great insights. I think for me, looking back at the process that we've all been a part of over the past year to develop the operational guidance, but also looking back a bit farther at how the humanitarian tech and data discussion has evolved, I'm hopeful. I think that we've had a long and hard road to get where we are in terms of actually reckoning with the challenges we face, but also the opportunities that technology and data present. And this is in some ways a turning point for us to recognize that we can and must do better. And now we've really put a framework forward to do this together. I think key calls to action would be have these conversations publicly and with your peers at the country level in an operational response context. Do not shy away from asking tough questions. Be bold about recognizing the risks, but also the opportunities that data presents, and then try as much as possible to learn from each other. I've often been reminded of a quote from one of my favorite books when I think about humanitarian tech, which is Tom Stoppard and Rosencrantz and Guildenstern are dead, saying that we cross our bridges when we come to them and burn them behind us with nothing to show for our progress, but the memory of the smell of smoke and a presumption that once our eyes watered. That has been the nature of the conversation for many years, but I don't think it is anymore. We're committed to move forward together on these issues and to make progress so that we're not having the same conversation 6 months or a year from now. Hopefully 6 months or a year from now, we'll be talking about all of the great impacts that we've made and the better work and assistance we've delivered thanks to responsible management of data. So thanks again, Mirva, for organizing this conversation, and thanks to everybody for joining.
Huge thanks, Stuart. And I can see also Joachim coming in with a comment to talk about we need to pay more attention to technology, the technology part. So personal sensitive data is only one part of the dilemma. So we hear you, Joachim, and it just speaks to the point that we definitely need more discussions and dialogue on this issue to also talk about, again, the technological piece, not only the data gathering and the management of sensitive data. So again, huge thanks to the panelists. Thank you so much for making the time And also huge thanks to all of the participants. Thank you for being present. Thank you for sharing your experiences. Thank you for asking questions, including some of the harder questions, because we need to be able to have an open and transparent conversation on these issues that we are facing and confronting, on the ground. So the bottom line is, and all of the panelists really concluded the meeting with really good concluding remarks. But the bottom line is data responsibility is everyone's responsibility. We need to make sure that we do this, taking into account a rights-based approach as we interact and as we engage and as we put people at the center, also in how we gather data and how we use this data. So many more discussions to follow. We're in the process of organizing our next IASC briefing. It will most likely be on accountability of affected people. So this is, again, was at the heart or at the core of the discussions today. And shortly, we'll be sharing details around when this briefing will be taking place. And we look forward to having you all online then. Huge thanks again, everyone, and wishing you all a good day and good evening, wherever you may be. Thank you so much again. Thank you.